हाँ जी, वैलकम करते हैं तुहाडा सारिਆਂ ਦਾ नर्सिंग करियर चैनल के उत्ते। सो जिन्हें भी हले तक चैनल में सबसक्राइब नहीं किया प्लीज़ चैनल में सबसक्राइब जरूर कर लिया करो ताकि हरेक वीडियो की अपडेट तुहाडे तक पहुँच सके। सो कम्यूनिटी हैल्थ ऑफिसर के एग्जाम के ये MCQ ने। सो स्टार्ट करते हैं आप फर्स्ट क्वेश्चन। FEM टैसट इज़ यूज्ड टू असैस। सो जिहड़ा FEM टैसट किया जाता किस नूं असैस करने लई किया जाता? ओवुलेशन, C A cervix, C pregnancy, D fetal maturity। सो द राइट आंसर फिर की होगा? FEM टेस्ट इज़ यूज टू assess ovulation। सो द राइट आंसर इज़ ovulation। ऑप्शन A इज़ द राइट आंसर। नैक्सट हैगा सैकेंड, द सेफेस्ट पोजिशन फॉर अ वोमन हु इज़ इन लेबर विद कॉर्ड प्रोलैप्स। So what is the safest position for woman who is in labor with a cord prolapse? A. Spine, B. Fowler, C. Trendelenburg, D. lithotomy। So the right answer is which position? Trendelenburg position। So option C is the right answer। Next question number third, fetal heart sound can be assessed as early as between। So in which condition? So fetal heart sound can be assessed early as soon as possible, 4 to 6 weeks, 8 to 10 weeks, 10 to 12 weeks, 16 to 18 weeks। So the right answer is option number B, 8 to 10 weeks। Option B is the right answer। Next question number fourth, what is the accessory gland located around the periphery of the areola? So what is the accessory gland located around the periphery of the areola? Bartholin gland, adrenal gland, Montgomery gland and pineal gland। So the right answer is option number C, Montgomery gland। So option C is the right answer। Fifth, what is the investigation helps to confirm acute lymphatic leukemia? So what is the investigation help to confirm leukemia? Platelet count, lumbar puncture, bone marrow biopsy and white blood cells count। So the right answer is which test confirmed is acute lymphatic leukemia? So bone marrow biopsy confirm the test and helps to confirm acute lymphatic leukemia। So option C is the right answer। Sixth, which among the following international voluntary health agency is conducting research in the field of health? So which international voluntary health agency conduct research in the field of health? SIDA, WHO, Red Cross, Danida। So the right answer is WHO, World Health Organization International Voluntary Health Agency is conducting research in the field of health। So option B is the right answer, WHO। Next, seventh, which stage of labor is also known as phase of placental separation? So which stage of labor is also known as phase of placenta separation? Third stage, second stage, first stage, fourth stage। So the right answer is option number A, third stage। Next हैगा, when was the DOTS program introduced in India? So when was DOTS program introduced in India? This is very important question। ਇਹਦੇ ਨਾਲ ਦਾ ਪੱਕਾ ਇੱਕ ਨਾ ਇੱਕ ਜਿਹੜਾ ਕੁਐਸਚਨ ਆ ਉਹ ਐਗਜ਼ਾਮ ਦੇ ਵਿੱਚ ਆਉਂਦਾ ਡੋਟਸ ਦੇ ਨਾਲ ਰਿਲੇਟਡ। ਕਦੋਂ ਪ੍ਰੋਗਰਾਮ ਸੀ ਜਿਹੜਾ ਇੰਟਰੋਡਿਊਸ ਕੀਤਾ ਗਿਆ ਸੀ ਇੰਡੀਆ 'ਚ? 1993, 2013, 2003 ਐਂਡ 2009। ਸੋ ਦ ਰਾਈਟ ਆਂਸਰ ਇਜ਼ 1993 ਦੇ ਵਿੱਚ डॉट्स प्रोग्राम ਜਿਹੜਾ इंट्रोड्यूस किया गया सी। नाइन्थ, हाउ मच ऑफ एनर्जी सप्लाइड 1 ग्राम ऑफ प्रोटीन? 2 kcal and 8 kilogram calories, 6 kcal and 4 kcal। So the right answer is how much energy supplied 1 gram of protein? 4 kcal। So the right answer is option number D। 10th, which among the following blood group is called universal donor? B group, O group, A group, AB group। So which blood group is called universal donor? It's a O group। Option number B, O blood group is a universal donor। Next question, what is the name of female pelvis? Anthropoid, gynecoid, android, and platyploid. So what is the name of female pelvis is? Option number B, gynecoid pelvis. Next, what is the working mechanism of autoclaving? Working under the water pressure, working under the power of electricity, working under the air pressure. And last one is working under the saturated steam pressure. So what is the working mechanism of autoclaving? Its answer is option number D, working under the saturated steam pressure. Option D is the right answer. Next, what is the drug of choice for a mother suffer with HIV? So the right answer is पहला ऑप्शंस देख लेने हैं, Axlocain, fluoxetine, cephalosporin and zidovudine. So the right answer is option D. Zidovudine is a drug of choice for mothers suffer with HIV. Next, which of the following method of sterilization kills the spore of the microorganism? A. Radiation, B. Fumigation, C. Boiling, D. Autoclaving. So which following method of sterilization kills the microorganism? It's a autoclaving. Option D is the right answer. Next, what is the name of mucus layer covering inside of uterus? Myocardium, perimetrium, endometrium, myometrium. So the right answer is option number C, endometrium. Endometrium, name of mucus layer covering inside of the uterus. Option C is the correct answer. Next, when was the Poor Committee was appointed in India? 2022, 1990, 2014, 1943. So Poor Committee was appointed in India in 1943. So option D is the right answer. Next, what is the aim of usage of oral dehydration solution in diarrheal disease management? A. Prevent weight loss, B. Prevent infection, C. Prevent vomiting, D. Prevent dehydration. So what is the aim of usage of oral dehydration solution in diarrheal disease management? It's a very important and easy question. So right option is prevent dehydration. Option D is the right answer. Next, what is the frequency of census in India? Once in 5 years, once a year in 5 years, yearly once in 2 years, once in 10 years. So what is the frequency of census in India? It's a once in 10 years. 10 ਸਾਲਾਂ ਦੇ ਵਿੱਚ ਇੱਕ ਵਾਰ ਹੁੰਦੀ ਆ. So option D is the right answer. Next, what is the conversion of one type of mature cells into another type of cells called? Hyperplasia, anaplasia, dysplasia and metaplasia. So what is the conversion of one type of mature cells into another type of cells called metaplasia? Option D. Next, which of the following part of the ear will be affected by otitis media? Eustachian tube, maston bone, pinna earlobe, labyrinth steps, tympanic membrane, mastoid. So which of the following part of ear will be affected by otitis media is? A. Eustachian tube and mastoid bone. So option A is the right answer. Next question, which of the following scale is used to measure the gestational age of newborn? So which scale is used to measure gestational age of newborn? Ballard scale, Apgar scale, Mercury scale and FLACC scale. So the right answer is Ballard scale. Option A is the correct answer. Next, move to the another one. Which of the following condition is contraindicated to take oral temperature? So contraindicated in taking oral temperature. Which of the following conditions? Adult with hypertension, unconscious patient, adolescent with fever, pregnant woman. So patient who is unconscious. So in this condition, contraindicated to take oral temperature. So option B is the right answer. Next, normal response of an individual to the loss of loved one is called. So normal response of individual to the loss of loved one: apathy, depression, grief, psychosis. So the right answer is whenever person lost our loved one, death for loved one, So is called, it's a grief. Option C is the right answer. Which of the following layers is protecting the lungs? Pericardium, pleura, permetrium, endometrium. So the right answer is pleura. Pleura layer is protecting the lungs. Option B. Next, what is the diagnosis of a person who is having false unshakable belief? Mutism, perception, delusion, phobia. So the right answer is delusion. Option C. Next, what is the cause of secondary PPH, postpartum hemorrhage? Uterine endotoxicity, retained placenta, puerperal sepsis, and lactation process. So, what is the cause of secondary postpartum hemorrhage? It's a retained placenta. Option B is the right answer. Next, the most difficult time to control diabetes during a maternity cycle. First trimester, second trimester, during intrapartum period, and puerperal. So most difficult time to control diabetes during a maternal cycle. So option C, during intrapartum period. Option C is the right answer. Next, which of the following is the highest diameter of pelvis? Anterior, posterior, lateral, oblique diameter, and all are equal. So the right answer is anterior posterior is the highest diameter of pelvis. Option A. Next, the greater danger in breech presentation: cord prolapse, precipitate labor, rupture of uterus, prolapse of foot. ਸੋ ਇਹਦਾ ਲਾਸਟ ਕੁਐਸਚਨ ਦਾ ਤੁਸੀਂ ਆਨਸਰ ਆ ਜੋ ਕਮੈਂਟ ਸੈਕਸ਼ਨ ਦੇ ਵਿੱਚ ਦੱਸਣਾ, ਤੇ ਮਿਲਦੇ ਆਪਾਂ ਨੈਕਸਟ ਵੀਡੀਓ ਦੇ ਵਿੱਚ। ਓਕੇ।